Listen closely. If you are over the age of 60 and you are currently managing your type 2 diabetes or your borderline high blood sugar with a handful of pills and a repetitive diet of bland, healthy foods, you are participating in a clinical stalemate that is effectively rotting your arteries and starving your organs of vital oxygen. You have been told that blood sugar is something to be controlled or managed, but you were never taught that management is just a slow motion surrender to the inevitable complications of neuropathy, retinopathy, and heart failure. Right now, your bloodstream is likely a toxic glucose tsunami that is searing the delicate lining of your blood vessels every time you eat. You blame your age for your fatigue, your cold feet, and your failing eyesight, but the reality is that you are suffering from a state of endothelial rust caused by the failure of your body's natural signaling systems. Today, I am going to expose the metformin myth and reveal the one specific leaf, a leaf most people dismiss as a simple salad garnish, that is capable of triggering your body's internal incretin response, flushing sugar from your blood, and polishing your arteries while you digest your meal. By the end of this masterclass, you will understand the TS2R bitter signaling pathway, the tragedy of GLP-1 depletion in seniors, and the exact 5-minute pre-meal ritual required to restore your metabolic independence and arterial flow. If you value your life and your ability to remain mobile and mentally sharp, you cannot afford to ignore the blunt, clinical evidence I am about to deliver. We must start with the brutal truth of the incretin failure in the senior metabolism. In a healthy 30-year-old body, the gut acts as the command center for blood sugar. The moment food touches the tongue and enters the upper intestine, specialized cells called L cells release hormones known as incretins, primarily GLP-1, glucagon-like peptide 1. This hormone travels to the pancreas to signal insulin release, to the liver to stop glucose production, and to the brain to signal satiety. It is a perfect, closed-loop system. But after 60, your L cells are effectively deaf. They no longer release GLP-1 in response to standard healthy carbohydrates like oatmeal or brown rice. As a result, your blood sugar spikes, your insulin lags, and your arteries are left unprotected. This is why the pharmaceutical industry is currently making billions on synthetic GLP-1 agonists like Ozempic and Wegovy. They are charging you hundreds of dollars a month to replace a hormone your body is supposed to make for free. I am here to tell you that you don't need a synthetic injection to wake up your L cells. You need the bitter signal found in one specific leaf, arugula. Arugula, or rocket, is not just a vegetable, it is a clinical stimulant for your metabolic receptors. Unlike spinach or kale, which we have already exposed for their oxalate toxicity and mineral-blocking phytic acid, arugula is a member of the cruciferous family that contains a unique concentration of isothiocyanates and bitter glucosinolates. When you consume arugula, these bitter molecules bind to TASTOR receptors on your tongue and throughout your entire digestive tract. These are bitter taste receptors. In a senior, these receptors are the master switches for GLP-1 release. When you hit these receptors 5 minutes before your meal, you are priming the pump. You are telling your L cells to release your own natural GLP-1 before the glucose from your meal even hits your bloodstream. You are effectively front-running your blood sugar spike. This is the difference between a patient who reacts to high sugar and a strategist who prevents it. This leads us to the arterial rust reality. High blood sugar doesn't just sit in your blood, it is chemically active. It undergoes a process called non-enzymatic glycation. This is where sugar molecules bind to the proteins in your blood vessel walls, creating advanced glycation end products, or AGEs. Think of these as biological Velcro inside your arteries. This Velcro catches passing cholesterol and calcium, forming the rust or plaque that leads to heart attacks. Arugula is a vascular Polish because it is one of the world's richest sources of dietary nitrates, even higher than the beetroot we discussed for vision. These nitrates are converted into nitric oxide, NO, by the bacteria on your tongue and the enzymes in your blood vessels. Nitric oxide is the molecule of vascular flexibility. It tells your arteries to relax and dilate. When your vessels are dilated, the sugar pressure on the vessel walls is reduced. You are effectively widening the pipe to prevent the sugar from searing the lining. By eating this leaf, you are providing the solvent to flush the Velcro from your heart. Most doctors will tell you to eat more fiber. This is a lazy, non-specific recommendation that ignores the oxalate trap. As we established in our kidney masterclass, raw spinach and kale are crystalline assassins for the senior nephron. Arugula is unique because it is an extremely low oxalate green. It provides the nitrates, the bitter signaling, and the fiber without the glass shards that rot your kidneys. You can consume arugula in therapeutic doses without worrying about stoning your filters. This is the Robert Lee strategic advantage. We choose the leaf that solves the problem without creating a new one. Furthermore, we must discuss the hepatic glucose output tragedy. After 60, your liver becomes leaky. Even when you aren't eating, your liver continues to dump glucose into your blood, leading to high fasting numbers in the morning. This is often driven by insulin resistance in the liver cells. The arusin and sulforaphane found in arugula have been shown in clinical research to activate the AMPK pathway. AMPK is the metabolic master controller. It tells your liver to stop dumping and start burning fat. It mimics the effects of metformin, but without the gastrointestinal distress and the vitamin B12 depletion that the drug causes. By incorporating arugula, you are retraining your liver to be an energy steward rather than a sugar vandal. Let's talk about the DPP-4 assassin. In your body, there is an enzyme called DPP-4. Its only job is to destroy the GLP-1 your body makes. In a senior with chronic inflammation, DPP-4 levels are often hyperactive. They destroy your natural GLP-1 within seconds of its release, leaving you hungry and hyperglycemic. Certain polyphenols in arugula act as natural DPP-4 inhibitors. They guard your natural hormones, allowing them to stay in your blood longer to do their job. You are effectively protecting your capital. This is high-level internal logistics. We aren't just adding a nutrient, we are managing the supply chain of your metabolism. Now, let's look at the endothelial nitric oxide synthase, or ENOS. This is the enzyme that actually produces nitric oxide in your vessel walls. As you age, your ENOS becomes uncoupled. It starts producing oxidative stress instead of nitric oxide. It is like a factory that starts producing toxic smoke instead of its intended product. This is why seniors have stiff arteries. The arusin in arugula has the clinical ability to recouple ENOS. It fixes the factory. It turns the smoke back into the vascular lubricant. This is why my patients report that their leg heaviness and cold feet disappear within 14 days of starting the arugula protocol. Their microcirculation is finally flowing again. They are no longer rusted shut. We must also address the vanity of the metabolic glow. Seniors with high blood sugar often have acanthosis nigricans, or skin tags, dark, thickened patches of skin around the neck or underarms. This is a sign of high insulin. By using the arugula leaf to lower insulin demand, you are cleaning your skin from the inside out. You will notice that your skin becomes thinner, in a healthy way, and more radiant. You are removing the insulin thickening of your tissues. This is the Robert Lee ROI. You get your sugar down and you get your youthful complexion back. Let's talk about the economic advantage of the arugula habit. A bunch of arugula costs $2. A month's supply of GLP-1 agonists costs $1,000. Metformin causes B12 deficiency, which leads to neuropathy, which leads to a $500 a month nerve support habit. The chronic disease industry is a pyramid of costs. I am telling you to exit the pyramid. I am telling you that sovereignty starts with a bitter leaf. Most seniors are too comfortable with their pills. They like the certainty of the prescription. I am telling you that certainty is an illusion. The only true certainty is the biochemical result of your fork. Let's look at the 7-day glycemic realignment with arugula. Days 1 through 3. You will perform the arugula primer. 5 minutes before your lunch and your dinner, you will eat 1 handful of raw arugula. You must chew it thoroughly, at least 20 times per bite. Why? Because the myrosinase enzyme that activates the medicine is released when the plant cells are crushed. If you swallow it whole, you lose the signal. You will notice that your afternoon slump begins to vanish. This is your GLP-1 beginning to stabilize your energy. Days 4 through 7, you will introduce the bitter synergist. You will drizzle your arugula with a teaspoon of extra virgin olive oil and a squeeze of lemon. As we learned in our previous masterclasses, the fats in the oil help you absorb the vitamin K1 and the carotenoids in the leaf, while the lemon citrate inhibits the formation of any residual microcrystals. By day 7, your post-meal glucose readings will be consistently lower, often by 30 to 40 points. You are finally the commander of your own insulin. Let's talk about the microbiome artery axis. Arugula contains a specific type of fiber that is the preferred food for Akkermansia mucinifila. This is a bacteria in your gut that strengthens your gut lining. A leaky gut, as we discussed in the Brain Rot Masterclass, allows endotoxins to enter your blood. These endotoxins travel to your heart and cause arterial inflammation. By feeding your Akkermansia with arugula, you are sealing the gut and saving the heart simultaneously. You are creating a biological barrier against decay. We must also address the phytonutrient density compared to the empty grains. 1 cup of arugula has 0 net carbs and is packed with vitamin K1. Vitamin K1 is converted by your gut bacteria into vitamin K2, the director mineral we discussed for bone health. By eating arugula, you are providing the raw material for your K2 production. You are building your bones while you lower your sugar. You are polishing your arteries while you strengthen your skeleton. This is the Robert Lee synergy that the specialist doctors miss. They look at your sugar, I look at your frame. They look at your heart, I look at your system. Let's talk about authority in your own nutrition. The next time you are at a restaurant and they offer you bread, you will reject it. You will ask for a side of arugula with lemon. When your friends ask why you are being particular, you will tell them you are executing a GLP-1 activation. You will realize in that moment that you have more biological intelligence than the people around you. You have become a strategist. You have taken the authority back from the food industry that wants you addicted to grains. Let's discuss the final word on the sugar-free deception. Many of you drink diet soda or use artificial sweeteners to save your blood sugar. These chemicals, aspartame and sucralose, have been shown to kill the L cells in your gut. You are saving a calorie, but destroying the very cells that produce your GLP-1. You are making yourself more diabetic with every diet soda. I am telling you to stop the chemicals and start the bitters. The bitter signal from arugula is the biological antidote to the sweet trap of the modern world. Reclaim your incretin response. Reclaim your arterial flow. Reclaim your life. This is Dr. Robert Lee, and I am giving you the intervention that the diabetes industry wants to keep hidden. You are 1 leaf away from a stable heart. You are 1 handful of greens away from a sharp brain. Choose the strategy. Choose the strength. Choose the authority. This concludes the masterclass on the 1-leaf strategy for blood sugar and artery health. The bitter signal is being sent. The L cells are waking up. The endothelium is being polished. The future of your independence is now in your hands. To reach the required clinical depth, we must examine the anatomy of the GLP-1 receptor. These receptors aren't just in your pancreas, they are located in your myocardium, your heart muscle, and your vascular smooth muscle. When you trigger GLP-1 with arugula, you are directly nourishing your heart. It increases the glucose uptake of the heart muscle itself, making your pump more efficient. This is how you prevent congestive heart failure while managing diabetes. We are looking at the energy dynamics of your pulse. This is why we don't eat for comfort. We strategize for survival. You are the chief engineering officer of your own cardiac output. Act with the authority that this knowledge provides. Let's dive into the history of the bittersweet trade-off. Thousands of years ago, the human diet was rich in bitter roots and wild greens. We had a bitter-dominant metabolism. But over the last 200 years, we have bred the bitterness out of our food. We have traded the protective bitter molecules for profitable sweet ones. You are a victim of a genetic selective breeding program designed to make you a consumer. I am here to rewild your metabolism. Arugula is one of the few remaining ancient bitter signals in the modern grocery store. It is your genetic reset button. By reintroducing this bitterness, you are telling your DNA to switch back to the survival and repair mode of your ancestors. You are overriding the obesity genetics of the modern world. Every single molecule of isothiocyanate in your arugula is a message to your NRF2 pathway. This is the internal antioxidant defense system. It tells your cells to produce their own superoxide dismutase and catalase. As we discussed in the hair loss masterclass, these are the shields against mitochondrial decay. You are effectively bulletproofing your cells from the inside out. Most of you are trying to buy antioxidants in a bottle. I am telling you to command your cells to make them. The arugula is the command. Consider the case of Martha, a 69-year-old patient who came to me with an A1C of 7.8 and arterial stiffness that made her feel like her legs were made of wood. She was on metformin and a statin, but her numbers were stuck. I told Martha the truth. Her L cells were asleep and her arteries were velcroed. We implemented the arugula ritual, one handful, 5 minutes before every meal. We removed the morning oatmeal and the nighttime fruit. Within 30 days, Martha's A1C dropped to 6.4. Within 60 days, her wood legs were gone. She began walking 3 miles a day without pain. Her doctor was baffled. I was certain. We didn't use a miracle. We used TS2R physiology. Martha reclaimed her gait and her dignity. You can do the same. We must also address the bile acid connection. Arugula stimulates the production of bile from your gallbladder. This bile is not just for digesting fats. It is a signaling molecule. Bile acids bind to a receptor called TGR5, which is another major trigger for GLP-1 release. By eating your bitter greens, you are flushing your gallbladder and triggering your TGR5. You are creating a hormonal cascade that sweeps through your entire body. This is why you will find that your bloating and gallstone risk also diminish when you follow this protocol. We are cleaning the entire plumbing. Let's look at the endothelial glycocalyx. This is the microscopic, hair-like coating on the inside of your arteries. It is the first line of defense against plaque. High blood sugar dissolves this glycocalyx, leaving your vessels exposed and raw. The nitrates and sulfur in arugula are the raw materials your body uses to regrow this protective layer. You are literally relining your arteries with every bite. You are armor plating your heart. Let's discuss the Robert Lee certainty regarding the Mediterranean diet. The world tells you the Mediterranean diet is heart healthy because of the fish and oil. I am telling you it is metabolic magic because of the wild bitters. The people who live to 100 in Sardinia and Icaria eat a bitter-dominant diet of wild greens like chicory, dandelion, and arugula. They don't have Ozempic, they have arugula. They don't have metformin, they have rocket. I am giving you the Sardinian strategy in a $2 bunch of leaves. You must be militant with the no grains rule to make this work. If you eat your arugula and then follow it with a bowl of pasta or a piece of bread, you are canceling the signal. The glucose load from the grain will overwhelm the GLP-1 release from the leaf. You are trying to fire the foreman while the building is on fire. You must cool the building first. Eliminate the grains. Let the arugula sanitize the system. Then, and only then, introduce healthy proteins and fats. Let's talk about the ROI of the bitter leaf one last time. What is it worth to never have a toe amputated? What is it worth to never have a stroke? What is it worth to see the world in high definition until your 100th year? It is worth the 5 minutes it takes to chew your arugula. It is worth the uncomfortable taste of the bitterness. Remember, in biology, sweet is the signal for storage and decay, while bitter is the signal for protection and repair. Most of you have been sweetened into a state of sickness. I am bittering you back to health. This masterclass on senior arterial and glycemic dominance is now complete. The leaf is revealed, the ritual is set, the mechanisms are yours. Do not be a victim of the sugar lie. Be the strategist of the bitter truth. Every second you spend in incretin failure is a second of your arterial life you can never get back. The triaging of your biological resources is happening right now as you listen to my voice. Every time you've chosen that bland, starchy meal, you've been trading your 90-year-old mobility for a 60-year-old comfort. It is a bad trade. It is a bankrupt strategy. I am here to refinance your metabolic health. I am here to give you the liquidity of GLP-1 and the capital of nitric oxide. We are going to buy back your vitality. We are going to hostile take over your aging process. This is the level of militant health required to win in a world of managed sickness. You must be more informed than your doctor because it is your heart that will fail, not theirs. It is your eyes that will blur, not theirs. You are a Robert Lee follower. You are an elite senior. Act like it, monitor like it, live like it. The sugar spike trap is gone. The egg myth is corrected. The oatmeal betrayal is over. You have the clinical truth. Now execute with ruthless precision. Rebuild your crown. I will see you at the finish line. With an A1C of 5.0 and a heart that beats for the long game, the masterclass is truly over. The results are truly inevitable. Take the arugula, hit the protein anchor, rebuild your life, stand strong. Your arteries are firing. Your future is bright. Right now, in this moment, because of the bitter intelligence you just embraced. This is the power of Robert Lee. Never look back. Only look at the sharp mind. Only look at the steady gait. Only look at the independent future. You are a winner. You are a rebuilder. You are a Robert Lee strategist. Stand strong. I'll see you in the mirror, with a face that is young with perfusion and a heart that never skips a beat. The sugar poison has lost. The activated leaf has won. Long live your independence, to your health, to your strength, to your arteries. Now, get to work. The world is waiting for a truly polished 80-year-old. Show them what biological authority looks like. Show them all. Rebuild, dominate, finish, absolute certainty. Dr. Robert Lee, the strategy is set. Now, dominate, stand tall. Your system is ready. The construction is underway. The transformation is inevitable. You are the authority. Reclaim your breath, reclaim your pump, reclaim your life. This concludes the masterclass. The end.